The Brain Injury Guide and Resources is a tool for professionals, community members, and family to understand traumatic brain injury, as well as how to promote better living for those who live with a TBI. In this interview, we will talk with Jeff Krug, clinical instructor of physical therapy in the MU School of Health Professions, to learn about physical therapy after a traumatic brain injury. And Jeff, thanks a lot for being with us. We appreciate it.
Glad to be here.
Jeff, at what point would a physical therapist become involved with a patient following a TBI?
Right. Physical therapy gets involved right away in the acute care setting. So they'll see people even when they're unstable medically, or kind of the scary environment where patients are attached to a lot of tubes and we're still trying to make sure they're healthy. And then we'll also see them once they're transferred to rehabilitation centers. So then we start to really focus on the things the person needs to do to get back home. And then we'll see them as outpatients. So they'll come in for outpatient therapy as well, maybe come in once or twice a week, sometimes more. We'll see them in home health and actually work with them in their home environment. So physical therapy covers a wide range of environments with this population.
What can you do for a person in the early stages when they're still in the acute care facility?
Right. The main focus then is keeping people flexible, doing things like range of motion and stretching them out, keeping their muscles loose, monitoring their skin to make sure that there's no skin breakdown or sores. So we might help with the positioning program the client has. We'll do some basic exercise lying in bed if the client's able to do that and able to kind of attend to what we're doing. We'll also make sure that as far as the positioning program goes, not only maintaining skin integrity, but keeping the flexibility aspect, not just stretching, but positioning plays a huge role. Often after damage to the brain or an injury to the brain, people develop some abnormal tightness, something we call muscle tone. And so we play a role in positioning, sometimes even using things like casts and splints to try to keep people as flexible as possible. So when they can get up and move around, the muscles haven't tightened up and they're not limited.
What are the overall goals of physical therapy?
Right. Our main goals are mobility. So it kind of is what it sounds like. It's all about the physical functioning. So we focus on the big things like getting in and out of bed, getting on and off the toilet, in and out of a wheelchair, in and out of the car. And then the big one, of course, is walking, which is a prime goal for a lot of people. So we're fortunate in that regard. It's very motivating. So we focus on mobility, and then what we really do is we analyze the aspects that affect mobility. So are there problems with strength, with flexibility? Is there abnormal muscle tone? How can we decrease it if it's too high or increase it if it's too low? Are there sensory problems, balance problems, coordination problems? So all of those basic impairments that result in problems with what we call functional limitations or functional activities like mobility.
So as a physical therapist, you really have to do some analysis at the outset to figure out what the patient needs before you actually engage in the therapy, obviously, right?
Right. We do a very thorough assessment. So covering all those aspects that I mentioned, we have some specific tests that we use. And then there's even some specific outcome measures for this population where instead of assessing just strength or sensation, we'll actually assess some movement activities, some tests and measures that have been studied and found to be reliable and valid. And so then we can take a baseline measurement on a person, how they do with some basic mobility skills. We can test them again later and see what kind of a change we're getting, and also determine, are they at risk for falling? What's their mobility like?
What are some other things? We talked about the early stages. What are some other things that you could do for a person with a TBI as they progress through the therapy?
Right. As a person moves into rehab, the goals really become about what does that person need to do to get back home. And of course, everybody wants to be a return to normal. So they want to be able to move like they did before. They want to be able to do all the activities that they did before. And so we're going to try to make that as possible, as we can. Sometimes that means compensating and teaching the person different compensatory strategies. Maybe one side of their body moves well and the other side has some limitations. Teach them to use the side that's intact. More specifically though, what we like to do in rehab especially is focus on regaining function. So we have some specific treatment approaches that we have learned and gone to continuing education and studied so that we can use those approaches to regain the movement that has been lost.
I would think there would be some differences in working with a child, an adult, and an older person. Is that right?
Yeah, absolutely. Some of it's just the interests that people have at different ages. When you're working with a child, it becomes more about play activities. When you're working with someone who's middle-aged, it becomes about, work and home activities. And likewise, with an older adult, it's some of the same homemaking or things that they do around the house or being able to do social activities, but maybe it's different in that, our bodies change as we get older, so how we move. So with kids, it becomes, how can we engage those kids? What can we do? We not only have to come up with what we're actually trying to treat, but we also have to come up with fun ways to do it. So it becomes about incorporating play into actually getting the movements that we want.
All right, Jeff, let's take a look at how you might work with a client.
Great.
And joining us now is Evelyn, who's going to help us with our demonstration. And Jeff, how would you help this client?
Right. Well, with traumatic brain injury, we could have a wide variety of presentations. Some clients are functioning at a lower level where they may not be responding to a lot of cues, following a lot of directions, have very limited movement. Therefore, our treatment would be really focusing on their positioning when they're lying in bed, when they're wheelchair, things to keep them flexible, splints and positioning devices, range of motion. But for our purposes, we're going to go ahead and Evelyn kind of simulate a common presentation that we see with brain injury. And that's where one side, her left side, is going to be a very strong side with lots of good movement. On the right side, we've got both legs, both extremities are a little weaker. Her arm is a little bit tighter. She's holding it in a position like this. And so that's a common presentation with one-sided weakness and abnormal tightness. And so we'll focus on that. And so with Evelyn, we would work on some bed mobility, lying down, rolling, sitting back up. But we're going to start with some more upright activities. And these are critical to brain injury recovery, especially with physical therapy. We want the body to start to feel things like it did before, be lined up and symmetrical in sitting and in standing, so it starts sending messages back to the brain, telling the brain where it is, and hopefully that gets the movement to start to happen again. And so we would start with some sitting activities, and that would involve some postural things. So I may sit on the side of Evelyn, or I may actually get up behind her and actually kneel behind her and encourage her body to be upright and lined up, equal weight on left and right side. And so I may use my hands or even other parts of my body just to kind of bring her upright, stretch her out, make sure she's leaning to both sides. I'll talk to my fellow team members, especially the occupational therapist, and discuss the best methods of maybe relaxing this arm and getting it to loosen up and putting it in a position where she's putting weight through it. That helps to kind of stretch it out and relax it as well. And then I can focus on what's going on at the trunk. We can strengthen the trunk muscles. We can work on some balance things while we're here, some reaching, some weight shifting. And then once Evelyn demonstrates some improved skills here, we would progress to where what we want to do is go from a sitting position to a standing position. And so, again, with traumatic brain injury, a variety of abilities. So the person's cognition may be impaired. They may not be able to follow directions. They may not understand what I want from them. And therefore, I may have to demonstrate, or better yet, in physical therapy, we use our hands, we use our bodies, especially in neurological rehab, to guide the movement. And so that's what I'm going to do, is I'm going to go ahead and tell Evelyn what I want, maybe even demonstrate, but then also guide her through the movement. And so the first thing we'll do is we'll say, Evelyn, I want you to go ahead and stand on up. And so we'll go to her legs and make sure they're on the floor. We definitely want that, so she's getting weight through her legs, sending those sensory messages to the brain. We're gonna make sure it's symmetrical. We may even take her weaker leg and move it back a little more than the other leg so that we're forcing that leg to do more of the work. And so now what we'll do is kind of guide Evelyn forward. And when she gets far enough forward, I'll say to her, if you feel like you're coming off the table, go ahead and stand up. Now, Evelyn may do like she just did and go ahead and activate those muscles and come to a full stand. Or maybe that she's a little bit weak, and so her leg wants to give way a little bit, her hip falls backward, you can see her trunk coming forward. So it's my job to kind of support her and guide her back into an upright position. I'm using my leg to block her knee so it doesn't give way. I've got an elbow on her hip, keeping her in place. I've got a hand on her chest. So we're getting that upright, good aligned posture. And then from here, what we can do is we can shift our weight a little bit and start to actually put more weight on this right leg. Typically, people like to rely on their strong side, so they'll lean onto the strong side and not give the weaker side a chance to do anything. But I'm going to guide her and help her to come over here so this leg gets the opportunity to feel this activity like it did before, and maybe start to resume functioning. If her leg wants to give way a little bit, what I can do is I can do a little bit of tapping over the muscle. I can rub along the muscle. A lot of times that'll help to stimulate it and get it to fire a little bit. We can press downward a little bit. That'll activate some of the muscles in her trunk and her hip and her leg. We can shift our weight side to side, but also forward and back. Start to get that leg coming forward over the foot. Maybe stretch that out if it's tight down around the ankle area. And then from here, once Evelyn's demonstrating that she can hold this posture fairly well, what we might do is ask her to go ahead and shift all her weight over to this side and then step forward with the left leg, and then shift and step back. So now when she shifts and steps forward, the entire body weight is going over this right leg. Lots of sensory feedback to the brain. Lots of stimulation to get those muscles firing and working again. Now, standing, shifting our weight, stepping and walking, those are things we've done throughout our entire life. They're kind of automatic. And so what we'd really like to do, at this point we've kind of broken walking into pieces. We're just doing the shifting and stepping here. And we'll probably get a decent response, but we might even get a better response from here if we went ahead and just started, if I provide some support and started her walking. It's an automatic activity. Our brain recognizes that. It's something we've done for a long time. So we'll try to tap into that as well. And then when it's time to rest or we finish the activity, we'll go ahead and make sure she's nice and controlled, slow sitting, very symmetrical, working the muscles not only coming up but also going back down. So those are some really good basic starting activities for a person at this level, just trying to get the body moving like it did before.
All right, Evelyn and Jeff, thank you so much for that demonstration. And we thank you for watching this interview on physical therapy after TBI, a service of the Brain Injury Guide and Resources.